Hi, my name is Jonathan Harms and I'm the CEO of Mental Health Carers New South Wales, the peak body for families and carers of people who experience mental illness in this state. We are delighted to be involved in the Central and Eastern Sydney Mental Health and Suicide Prevention Regional Plan because we see this collaboration between Sydney Local Health District, South East Sydney Local Health District and the Central and Eastern Sydney Primary Health Network, each funded by different tiers of government, to be a crucial collaboration to see service planning improved and made much more seamless and effective for carers and consumers across the state. This project will take 3 years and is scheduled for completion in December of 2022.
Hi, I'm Kat McPherson. I'm a mental health manager at Central and Eastern Sydney PHN, and I'm also co-chair of the implementation committee of the regional plan with Jonathan.
Joint regional service planning is important because it strengthens collaboration between services, it improves the use of resources, it avoids duplication, and it improves the outcomes achieved by people who receive more consistent and effective service support. Our ultimate aim are better services for people who experience mental health issues or suicidal crisis.
Regional planning is a collaborative process. Since our launch in October 2019, we've drawn on a range of expertise, including the local health districts, the hospital networks, the Mental Health Coordinating Council, being and Mental Health Carers New South Wales, community managed organisations, and lived experience representatives. We're really proud to have so many carers and consumers involved in the regional plan and all our working groups and committees. The ideas and insights have made a huge impact on what we've been able to do as part of the regional plan.
In late 2020, we reviewed our progress after 1 year of implementation. We noticed that we've begun to identify some of the real problems, but also some of the real solutions to joint service planning and some long-standing issues in the sector.
We've achieved so much. We've started 60 actions of the regional plan, and of these, 80% were on track for completion, which is a really great result.
One of the areas in which pleasing progress has been made is in the development of a local service navigation tool to assist carers and consumers finding the services they need in their areas. We know from our experience as a peak that this is an area of frustration for many people trying to use our mental health sector.
One thing I'm excited about from our achievements is our new online service navigation tool, Head Start. This tool was funded by the PHN, but what has made it a real success has been the contributions from our regional plan partners and the carers and consumers who've been involved. It's these contributions that have made it such a great tool that will be so useful for our community.
In coming years, we hope to have a good hard look at how our mental health system works as a whole, so that we can make mental health services based in hospitals or in the community work more effectively together. This is another long-standing issue that many carers and consumers have experienced, and we look forward to being able to make progress by having all services planned together to overcome these kinds of difficulties.
We've made a great start to the work, but we know there's a lot more to be done. COVID-19 and the challenges we saw in 2020 have had a really big impact on our community, and it's made our work even more important. There've been a lot more social challenges, but also a great strain on our mental health resources and services. So as we begin our work in 2021, we'll need to keep looking at our system as a whole and strengthening it so we can meet the current and the future demand.
As mental health carers, we understand that services can only be effective and supportive if they prioritise the experience and the outcomes achieved by the consumers of those services. We are delighted to support the regional plan for mental health and suicide prevention because it prioritises consumer experience as well as carer experience in co-designing the reforms, the services and the changes that we need to our mental health system. And we think this gives it an excellent chance of great success.
If you want to learn more about regional planning, You can talk to a colleague who's involved in the project, or you can visit the regional planning page on the Central and Eastern Sydney PHN website.